Hi gang, welcome back to Ask the Doctor. Thanks for joining us on this new platform. I've got to tell you, it really weighs heavily on Dr. C and me when we can't get to all of the questions that you guys ask us on this channel. We know that you really depend upon our support and our guidance, and we don't take that responsibility lightly. So we've decided to take your most burning questions and answer them here for you. So let's look at today's question. Today's question is from Robert, and he asks, what should I take for my neuropathy? Well, this is a common question that we get time and time again. In our 19 years of treating peripheral neuropathy cases, we found the basic foundation for nerve repair begins with essential nutrients that your nerves need for their health and really to maintain their normal function, and when they're injured, to restore their normal function. And these nutrients are even more vital when those nerves get damaged. So clinical studies have shown that when trying to facilitate nerve repair and regeneration, the vital nutrients that you need to lay this foundation consist of things like Benfotiamine, Pyridoxal 5-phosphate, Methylcobalamin, R-alpha lipoic acid, Folate, and Acetyl L-Carnitine and L-Citrulline. And what's equally important is using these nutrients in their proper amounts, which have been outlined in many clinical studies. And as a matter of fact, we created 2 videos on this, vital nutrients for nerve repair and the right dose. And these videos contain all of this information for you. So basically, that's where you need to start for your neuropathy recovery. Now, I have to tell you, when we first began treating peripheral neuropathy about 19 years ago, each of our patients, poor guys, these patients had to go out and buy all 7 of these nutrients separately. So I'm talking 7 different bottles, which got a bit pricey to say the least. Not to mention that in order to take the correct amount of each supplement as what was outlined in the research, they were taking close to 20 pills a day. Well, as you might imagine, there weren't many of our patients that were thrilled about this, and compliancy really became an issue. It was difficult to get our patients to be consistent and stick with the protocol. So we teamed up with a biochemist to help us develop a formula containing all 7 ingredients in their correct amounts. Well, the biochemist told us that it was impossible to get all 7 nutrients into just 1 or 2 capsules in the necessary amounts. So we actually had to divide this formula up, and that's how we ended up developing Neuphoria CM Gold and Nerve Defense. Our gold formulation contains Benfotiamine, P5P, Methylcobalamin, Folate, and the RALA, and begins really the repair process of the nerves. And then our Nerve Defense formula contains the L-Citrulline and the Acetyl L-Carnitine, which protects your nerves from further damage and really it really helps to improve the circulation and the blood flow, which is going to restore more nutrients to your nerves. Now, I promise you, this isn't our opinion. This has been well documented in many research and clinical studies. So those are basically the nutrients that you're dealing with. Those are the key players that you're going to need to restore your peripheral neuropathy and your health, and that's going to lay the foundation for your recovery from peripheral neuropathy. That's a great question. Thanks so much, Robert, for asking that.